Okay, so hip dissociation is one of the biggest factors that's going to lead to more consistent swing. Now, having worked with a lot of mid-handicap golfers, this is one area that I find they really struggle with early on, but then when they start to master this movement, they start to get the gains. Now, basically, it's your ability to separate your upper body and your lower body. So if you look at lower body separation or hip dissociation, it's the ability for me to actually rotate that lower body whilst keeping that upper body nice and still, okay? Now what I tend to see is a lot of people tend to move their upper body or they'll go laterally sideways, okay? So it's really thinking about trying to keep that upper body still. Now what we can do is we can anchor ourselves off a golf club here, and I can just look to get a lot of movement through there. So lower body rotation, you see my knees are going forward, okay? And that lower body's starting to rotate. There's two factors to consider. Is it a motor control issue? So your ability of your core to actually perform that movement. Can you get into that position and can you do it? Do you have the ability or the control to do so? Or is it actually a mobility issue? There's some sort of mobility, whether it be a lack of a hip internal rotation that's preventing you from doing it. Now, can you perform it like this? Okay, so what we can do, can you move like that? If you can't, what we can do is we can anchor you down and then look to see if we can do it like that. Okay. Now if you still struggle there, we probably need to go and address your hip internal rotation, and that's going to be your ability to actually sort of rotating in there or loading that trail here. Now, a lot of mid-handicap golfers tend to get into this position here, and as they go into that backswing, because they can't load that trail into a rotate, they tend to sway, and that's just going to cause that up and out and going to go into that big slice, okay? So first of all, can we move those hips? If we want to be able to address it, we want to think about how do I improve my hip internal rotation. And the simple 90-90 one is this one here, so I can sit here, sitting up nice and straight, and just looking to push those knees down like that. Okay, that's encouraging my hip internal rotation. So if you can go about trying to work on that one, that's going to help improve your hip internal rotation. Now, this is exactly how I learned how to master this movement, because I was a golfer that used to always come back here, always here, and that shot shape was going up to the right into the neighbouring fairway. Now the way I mastered it is I did this every day. Okay, now what I did, believe it or not, in the shower, I'll just be there practicing, because you have a shower every day. If you can get there, whether you want to put your hands on the glass, okay? So demonstration from here, just getting those hips moving. Okay, so you can anchor yourself off the glass there, get those hips moving. And otherwise, if you've mastered that and you don't need the anchor, I suggest just trying to work it through here, even just for 30 seconds every day. Just get those hips moving, getting as much rotation as you can. Okay, that is going to be the key. If you can do this every day for the rest of the month, I guarantee you'll be able to master it. And that's going to be the difference between able to load that trail hip here and getting out of that lateral movement, which is going to keep you on that handicap where you are right now.